Ending Crime and Disorder on America's Streets Executive Orders, July 24, 2025, by the authority vested in me as President by the Constitution and the laws of the United States of America, it is hereby ordered. Section 1. Purpose and Policy. Endemic vagrancy, disorderly behavior, sudden confrontations, and violent attacks have made our cities unsafe. The number of individuals living on the streets in the United States on a single night during the last year of the previous administration, 274,024, was the highest ever recorded. The overwhelming majority of these individuals are addicted to drugs, have a mental health condition, or both. Nearly two-thirds of homeless individuals report having regularly used hard drugs like methamphetamines, cocaine, or opioids in their lifetimes. An equally large share of homeless individuals reported suffering from mental health conditions. The federal government and the states have spent tens of billions of dollars on failed programs that address homelessness but not its root causes, leaving other citizens vulnerable to public safety threats. Shifting homeless individuals into long-term institutional settings for humane treatment through the appropriate use of civil commitment will restore public order. Surrendering our cities and citizens to disorder and fear is neither compassionate to the homeless nor other citizens. My administration will take a new approach focused on protecting public safety. Succinct 2. Restoring civil commitment. A. The Attorney General, in consultation with the Secretary of Health and Human Services, shall take appropriate action to I. Seek, in appropriate cases, the reversal of federal or state judicial precedents and the termination of consent decrees that impede the United States policy of encouraging civil commitment of individuals with mental illness who pose risks to themselves or the public, or are living on the streets and cannot care for themselves in appropriate facilities for appropriate periods of time. And 2. Provide assistance to state and local governments, through technical guidance, grants, or other legally available means, for the identification, adoption, and implementation of maximally flexible civil commitment, institutional treatment, and step-down treatment standards that allow for the appropriate commitment and treatment of individuals with mental illness who pose a danger to others or are living on the streets and cannot care for themselves. Second 3. Fighting vagrancy on America's streets. A. The Attorney General, the Secretary of Health and Human Services, the Secretary of Housing and Urban Development, and the Secretary of Transportation shall take immediate steps to assess their discretionary grant programs and determine whether priority for those grants may be given to grantees in states and municipalities that actively meet the below criteria to the maximum extent permitted by law. I. Enforce prohibitions on open illicit drug use. Tier 2. Enforce prohibitions on urban camping and loitering. ICA. Enforce prohibitions on urban squatting. IV. Enforce, and where necessary, adopt standards that address individuals who are a danger to themselves or others and suffer from serious mental illness or substance use disorder, or who are living on the streets and cannot care for themselves, through assisted outpatient treatment or by moving them into treatment centers or other appropriate facilities via civil commitment or other available means, to the maximum extent permitted by law. Or V. Substantially implement and comply with, to the extent required, the registration and notification obligations of the Sex Offender Registry and Notification Act, particularly in the case of registered sex offenders with no fixed address, including by adequately mapping and checking the location of homeless sex offenders. B. The Attorney General shall I. Ensure that homeless individuals arrested for federal crimes are evaluated consistent with 18 U.S.C. 4248, to determine whether they are sexually dangerous persons and certified accordingly for civil commitment. 2. Take all necessary steps to ensure the availability of funds under the Emergency Federal Law Enforcement Assistance Program to support, as consistent with 34 U.S.C. 50101 ATSEK, encampment removal efforts in areas for which public safety is at risk and state and local resources are inadequate. C. Assess federal resources to determine whether they may be directed toward ensuring, to the extent permitted by law, that detainees with serious mental illness are not released into the public because of a lack of forensic bed capacity at appropriate local, state, and federal jails or hospitals. And Rev enhance requirements that prisons and residential re-entry centres that are under the authority of the Attorney General or receive funding from the Attorney General require in-custody housing release plans and, to the maximum extent practicable, require individuals to comply. Second 4. Redirecting federal resources toward effective methods of addressing homelessness. A. The Secretary of Health and Human Services shall take appropriate action to I. Ensure that discretionary grants issued by the Substance Abuse and Mental Health Services Administration for substance use disorder prevention, treatment, and recovery fund evidence-based programs and do not fund programs that fail to achieve adequate outcomes, including so-called harm reduction or safe consumption efforts that only facilitate illegal drug use and its attendant harm. 2. Provide technical assistance to assisted outpatient treatment programs for individuals with serious mental illness or addiction during and after the civil commitment process, focused on shifting such individuals off of the streets and public programs and into private housing and support networks. And 3. Ensure that federal funds for federally qualified health centers and certified community behavioral health clinics reduce rather than promote homelessness by supporting, to the maximum extent permitted by law, comprehensive services for individuals with serious mental illness and substance use disorder, including crisis intervention services. B. The Attorney General shall prioritize available funding to support the expansion of drug courts and mental health courts for individuals for which such diversion serves public safety. 5. Increasing accountability and safety in America's homelessness programs. A. The Secretary of Health and Human Services and the Secretary of Housing and Urban Development shall take appropriate actions to increase accountability in their provision of and grants awarded for homelessness assistance and transitional living programs. These actions shall include, to the extent permitted by law, ending support for housing first policies that deprioritize accountability and fail to promote treatment, recovery, and self-sufficiency, increasing competition among grantees through broadening the applicant pool, and holding grantees to higher standards of effectiveness in reducing homelessness and increasing public safety. B. The Secretary of Housing and Urban Development shall, as appropriate, take steps to require recipients of federal housing and homelessness assistance to increase requirements that persons participating in the recipients' programs who suffer from substance use disorder or serious mental illness use substance abuse treatment or mental health services as a condition of participation. C. With respect to recipients of federal housing and homelessness assistance that operate drug injection sites or safe consumption sites, knowingly distribute drug paraphernalia, or permit the use or distribution of illicit drugs on property under their control, I, the Attorney General, shall review whether such recipients are in violation of federal law, including 21 U.S.C. 856, and bring civil or criminal actions in appropriate cases. And 2. The Secretary of Housing and Urban Development, in coordination with the Attorney General, shall review whether such recipients are in violation of the terms of the programs pursuant to which they receive federal housing and homelessness assistance and freeze their assistance as appropriate. D. The Secretary of Housing and Urban Development shall take appropriate measures and revise regulations as necessary to allow, where permissible under applicable law, federally funded programs to exclusively house women and children and to stop sex offenders who receive homelessness assistance through such programs from being housed with unrelated children. E. The Secretary of Housing and Urban Development, in consultation with the Attorney General and the Secretary of Health and Human Services, shall, as appropriate and to the extent permitted by law, I. Allow or require the recipients of federal funding for homelessness assistance to collect health-related information that the Secretary of Housing and Urban Development identifies as necessary to the effective and efficient operation of the funding program from all persons to whom such assistance is provided, and 2. Require those funding recipients to share such data with law enforcement authorities in circumstances permitted by law and to use the collected health data to provide appropriate medical care to individuals with mental health diagnoses or to connect individuals to public health resources. Section 6. General Provisions. A. Nothing in this order shall be construed to impair or otherwise affect I. The authority granted by law to an executive department or agency, or the head thereof, Or 2. The functions of the Director of the Office of Management and Budget relating to budgetary, administrative, or legislative proposals. B. This order shall be implemented consistent with applicable law and subject to the availability of appropriations. C. This order is not intended to and does not create any right or benefit, substantive or procedural, enforceable at law or in equity by any party against the United States, its departments, agencies or entities, its officers, employees or agents, or any other person. D. The costs for publication of this order shall be borne by the Department of Housing and Urban Development. Donald J. Trump, The White House, July 24, 2025.